Welcome to today's webinar in the Knowledge Miles series, part of the Lord Mayor's lectures on behalf of Alderman Professor Michael Manelli, whose theme for his mayoral year is Connect to Prosper. In this free online lecture series, we address the connections in and around the square mile, what Michael likes to call the world's coffee house, and how these might help us to tackle future global challenges. I'm Professor Tim Connell, Chairman of the Gresham Society and a Fellow of Gresham College here in the City of London, and I'm also a liveryman of the Stationers' Company. So I'll be convening the session and moderating the questions and answers after today's lectures. So this is a plan for today. Very quick introduction from me, the keynote presentation from Professor Brian Lawler, and then we have about 20 minutes for questions afterwards. Today we've got a very current topic, the lonely brain, how designing for brain health can help tackle the loneliness epidemic. I'm delighted to welcome Brian Lawler, Professor of Old Age Psychiatry at Trinity College Dublin, and Site Director of Global Brain Health Institute at Trinity. He's also previously worked as Chief of Psychogeriatrics at Mount Sinai Hospital in New York. So Brian, can you tell us something about yourself?
Thanks, Tim. Great to be here. So I've been a psychiatrist for the past 40 years, worked in the United States and back here in Ireland. And my main area has been working with older people in the area of dementia and depression, but I've become convinced about the importance of loneliness. And loneliness now has reached epidemic proportions, and it's a very significant comorbid feature of people with mental illnesses. And so I've been involved in clinical studies and also research in the area of loneliness. And over the last 10 years, I've been site director for the Global Brain Health Institute. And in the Global Brain Health Institute, we bring together people from many different professions and disciplines to train in the area of brain health and dementia prevention. And one of the factors that's very significant in terms of increasing risk of dementia and poor brain health is loneliness. So my two areas of passion, loneliness and brain health, are going to be joined in this lecture. And I'm going to be talking to you about, as Tim said, how designing for brain health may be able to help us tackle this current loneliness epidemic.
Right now, so can you tell us more about the lonely brain and how designing for brain health can help tackle the loneliness epidemic? So over to you now.
So hello, everybody, and just welcome to this talk. I'm going to be telling you about how designing for brain health can potentially help tackle the epidemic of loneliness. So let me start with a quote from Kurt Vonnegut, who was a famous American writer and humorist. And what he said, and remember, this was said 40 years ago, well before we were talking about a loneliness epidemic. He said, what should young people do with their lives today? Many things, obviously, but the most daring thing is to create stable communities in which the terrible disease of loneliness can be cured. So I'm going to talk to you about loneliness and the impact that loneliness has on our health and our well-being, and particularly on our brain health, but also how designing for brain health and improving brain health may be able to tackle the current epidemic of loneliness. So here's an outline of my talk. I'll describe to you what loneliness is and why it's become a modern epidemic. I'll talk about the impact of loneliness on health and particularly on brain health. I'll talk about what brain health is and how creating a brain health friendly environment may be able to mitigate loneliness. Then I'm going to give you some examples from Japan and from Ireland where projects are integrating brain health principles into housing design to build sustainable communities and tackle loneliness. And then I'm going to give some concluding remarks about this population level approach to loneliness, designing for brain health, why it is a way to create stable communities to prevent the terrible disease of loneliness. So the drive for social connection happens in our brain. It's a primary drive. And when you become acutely socially isolated, if you're experimentally taken away and isolated for 10 hours, this evokes midbrain social craving. It's similar to hunger pains. It's a social pain. So this drive for social connection is biologically driven. It's part of our innate biology. So if you feel isolated, excluded, if you feel disconnected, this causes a pain, the pain of loneliness. It's a social pain, and this drives you to connect socially. So loneliness is subjectively experienced. It's unpleasant, it's aversive, it's painful. And essentially, loneliness is a dissatisfaction with the quality of your social relationships. It's very, very different to voluntary solitude or just wanting to be alone. There are two main dimensions of loneliness. You've got emotional and social loneliness. Emotional loneliness is where there's an absence of a confidant. That's someone to talk to, someone to trust, someone you can confide in. And when you experience emotional loneliness, there's a sense of hypervigilance, mistrust, you're overly sensitive, you may be prone to misinterpret what's going on, and your empathy levels drop. Social loneliness, on the other hand, is a lack of social integration and embeddedness. And social loneliness can occur when you move from secondary school to college, you move from one city to another, one country to another. And this is where you feel a degree of marginalization, a sense of boredom, feeling excluded, and you may have poor concentration. Now, social and emotional loneliness can co-occur, they can overlap, but generally speaking, one dimension of loneliness tends to predominate at any particular time. And I would say it's the emotional loneliness that is more damaging for your health and for your mental health. So there are thinking and feeling parts to loneliness. The thinking part of loneliness is this negative, mistrustful mindset. The feeling part is a painful, unpleasant feeling, is something that you want to avoid at all costs. Now, loneliness is very, very common across the population, whether you're young or old. About a quarter of people will report that they feel lonely sometimes. About 10% will say that they often or always feel lonely. So about 5 to 10% of the population, young and old, will have a significant level of loneliness that interferes with their quality of life, with their ability to form relationships. There are a number of different risk factors for loneliness. The first one is living alone, and I'll talk a little bit more about that later. Being widowed, having a physical disability, having a poor social network. These are all risk factors for loneliness, as is female gender, lower socioeconomic status, being a caregiver, having a mental illness, retirement, and bereavement. And interestingly, during COVID, we saw how caregivers and people with mental illness were increasingly at risk of developing high levels of loneliness. Now, loneliness can be transient or situational. For example, if you experience a bereavement or you retire, you become a caregiver, and during COVID-19, there was a lot of transient and situational loneliness. But transient or situational loneliness can become chronic. And of course, it's the chronic loneliness, particularly the emotional loneliness, that's most damaging to our health and well-being. And here you see the impact of chronic loneliness on mortality. Chronic loneliness increases mortality compared to situational loneliness or not being lonely at all. Now, the health risks and the health impact of loneliness are quite significant. It's about the same as cigarette smoking and other major biomedical and psychosocial risk factors. The overall risks of death are similar to smoking and are probably greater than high blood pressure and obesity. And for example, drinking more than 6 drinks a day. So that's quite a significant amount of alcohol. And the impact of loneliness is at least as bad as that. So it's nothing to be sneezed at. So loneliness is associated with a long list of increased risk of poor health. So increased risk of death, high blood pressure, stroke, heart disease, diabetes, sleep disturbance. And from a mental health point of view, increased risk of suicide, depression, risk of dementia, and developing a psychotic illness. I just want to focus a little bit on the effects of loneliness on the brain. So there is a cognitive impact. Loneliness increases cognitive decline, but over a lifetime can increase your risk of developing dementia. From an emotional point of view, you can develop compassion fatigue, low levels of empathy, and burnout due to loneliness. And very importantly, from a mental health point of view, loneliness is associated with increased risk of depression, anxiety, psychosis, and suicide. There are significant societal costs, £8 billion in terms of additional healthcare costs and decreased work productivity. Sometimes people seem to think that loneliness only happens in older people. COVID-19 dispelled that myth. Loneliness occurs right across all age groups and is quite significantly affects younger people. So why do we have an epidemic of loneliness? Here you see the rise of one-person households that's occurred since the late 19th century, following the Industrial Revolution. And you can see very significant increase in the rise of one-person households. And this is tightly coupled with the reports of loneliness. Now, while we can't say that the rise of one-person households is definitely causal in terms of the epidemic of loneliness, it does seem to be closely related. Also, we're seeing that most countries are moving more towards greater individualism. And we know that people in individualistic societies compared to collectivist societies feel more lonely. So we've got more individualism as our society, but also more one-person households worldwide. So up to 40% of households now worldwide are single person. In the US, it's 30%, and that's up from 10% in the 1950s. Japan, a rapidly aging society, 38% of households are one person or single person. So we have more people living alone, not getting married, delaying childbearing, more childlessness, longer lifespans, more widowhood, more divorce, and this desire for autonomy and independence. All of this is driving the epidemic of loneliness. We also appear to be disconnecting as a society, and here you can see that social engagement with friends and others and companionship is plummeting in young Americans, but right across the globe. And that's happening over the past 2 decades. And this has been particularly problematic for Black Americans who've experienced more social isolation and less social engagement. And just a word about Japan, which has a rapidly aging society and single-person households at 38%. This year alone, 68,000 older people are expected to die alone, the so-called solitary deaths. 15% of older men in Japan speak to one person or fewer every 2 weeks, and 30% have no one to turn to if they need help. So if they wanted someone to help them fix a light bulb, they wouldn't have someone to turn to. So these are very stark figures in terms of what's happening out there. And I think what we see in Japan, is really the future of what's going to happen in our societies. So it's a serious problem. How can we tackle the loneliness epidemic? And the question is whether designing the built environment and the social infrastructure for brain health, could this be a solution at a population level for the loneliness epidemic? So just a word about brain health. What do we mean by brain health? Well, brain health is achieving the best cognitive, emotional, psychological, and behavioral functioning that you can get. So it's not about the absence of brain diseases. It's about protecting the brain, reducing risk to the brain, and building reserve in the brain. So your brain is better able to deal with the wear and tear and the effects of aging. Here on the right side, you see the big 14 risk factors for dementia or poor brain health. So in early life, it's low levels of education. In midlife, it's hearing loss, high cholesterol, depression, traumatic brain injury, physical inactivity, diabetes, smoking, hypertension, obesity, excessive alcohol. And then later in life, social isolation and loneliness, air pollution, and visual loss. And what we believe from a brain health point of view is that if you address all of these risk factors, there's the potential to prevent dementia because these are potentially modifiable risk factors. And that's the thrust of taking a public health approach to dementia, looking at prevention. And that's really what we are about in the Global Brain Health Institute. But risks of brain health go beyond individual risks. You also have to look at social determinants of brain health. You have to think about the social and the community context in which people live, education, socioeconomic status, the quality of the neighborhood, the housing stability, the built environment, healthcare, access, and health. These are the social determinants are as important or perhaps even more important than individual risks to brain health. Loneliness and brain health have shared structural and social determinants and risk factors. So economic status, poverty, living alone, neighborhood deprivation, they're all linked to both loneliness and the risks for poor brain health. Smoking, alcohol abuse, hearing and visual impairment, hypertension, depression, and physical inactivity are all risk factors for the development of dementia, but they're also associated with being lonely. So what I'm suggesting is that if we design to protect and improve brain health, we can potentially design out loneliness and mitigate its impact. Now, neuroarchitecture brings together the fields of neuroscience and architecture. And the idea behind neuroarchitecture is that you can design the built environment to build a stronger brain. And we know from animal studies that if you enrich the environment of animals, you can show that they have greater brain plasticity. They have more enriched connections between their neurons in their brains. And we believe the same is true for humans. But if you have an impoverished environment, that can have a negative effect on your brain health and on your brain development. We know that sound, color contrast, natural light, nature, they all affect our physiology, cognition, and emotion. For example, sound and natural light, they can have effect on heart rate variability. They can also induce calm, decrease anxiety and stress. So neuroarchitecture is really about designing the built environment to challenge the brain, to create novelty, curiosity, and fun, because this is all good for your brain health. So the ideal design features for a brain health friendly environment are that they encourage physical activity, provide sensory, cognitive, and social stimulation. But passive design features aren't enough. We need to enable a vibrant social infrastructure for brain health. We make it easier for people to connect, to trust one another. So things like transport and access to resources and facilities are key. We need to focus and encourage intergenerational contact and community participation. Pro-social activities of volunteering are really important. Innovative ideas like chatty checkouts at the supermarket, where people can go slow and have a conversation. These can help with social connection, creating third spaces where people can meet and interact. Providing access to fun activities, arts, culture, and sports. These are all hugely important in creating a vibrant social infrastructure for brain health, but they can also mitigate loneliness. Safety and loneliness are connected, and we need to design to allow for safe living. And this is particularly true for older people. And we've carrying out studies with older people in rural areas. They equate safety and loneliness, those two concepts together. We need to create surroundings, communities where there's psychological safety. And if an older person doesn't feel personally safe after dark, that's a big barrier for them to be socially engaged, and that's going to increase their level of loneliness. So what's the evidence that these design features can impact loneliness? Well, we know that improving social structure is the best way to address loneliness. So providing access to transport and spaces for people to bump into one another, that works. Spaces that enable visiting, access to natural spaces, community spaces, places where people can walk, cycle, and socialize. They all are positive for social connection, and they help decrease loneliness. And leaning on greening is a good concept, creating access to natural spaces where people can meet. This has positive effects on their mental and cognitive health and on their loneliness. And we know this from a number of studies in Australia and in Canada. For example, urban greening targets of 30% in a total area has been shown to lower loneliness by up to 26% among adults. And this effect is greater in individuals who live alone. We need to understand more about the mechanisms linking green space and loneliness. And these studies need to be replicated to convince policymakers to actually introduce higher greening targets. But it looks like this approach, leaning on greening, can help mitigate loneliness. We also need to think about loneliness, professional loneliness in the workplace, and what we can do to adjust and adapt the workplace environment. Workplaces can become a source of health and well-being rather than harm. And instead of people feeling isolated and lonely at work, by making adaptations, creating third spaces, cafe, lounges, areas where people can meet and interact, this can mitigate professional loneliness. And again, post-COVID-19, with blended working, we need to think about creative solutions to enhance the opportunities for people to connect. Otherwise, there's going to be a further rise in loneliness. I just want to give you 3 examples of design and social infrastructure projects where these are real efforts to combat loneliness and improve brain health. The first of these is in Japan, and I've already outlined the major problems of loneliness in Japan. And the Abashio project, which was developed by one of our fellows here at the Global Brain Health Institute, is about creating socially integrated and sustainable communities. It's a non-profit organization, and really what they do is empower older people to contribute to their community. They help older people redefine their roles in their community and in society. there's co-production, co-creation, where older people themselves design spaces, they make changes, they take ownership of these changes that allow them to sustain themselves and their own community. And this has been shown to build a sense of community, but also decrease loneliness. And these projects are happening in Singapore, Philippines, and in Japan. Another project from Japan is the Nagaya Tower. And this is a rather interesting and innovative intergenerational solution to loneliness, which is a little bit back to the future, because what they're doing is going back to taking some of the older community models of collective housing from centuries ago. So this tower, it's V-shaped, it's got 6 floors. The V-shapes mean that when you come out of your apartment, you really have to interact or meet with people. It's intergenerational. The exterior balconies have no partitions, and here you see 2 people from different generations, older and younger, having a chat on the balcony. There's communal dining and meeting areas. And essentially, there's mutual support for young and old, and this is an effort to decrease loneliness. And now the final example is from Ireland, which is the Brain Health Village in County Wicklow. And this is a partnership with Respond, Ireland's largest housing-approved housing agency or body. You see a picture here of Rathcorn, this village, where people are being housed in social housing, and we had an opportunity to get in early and help with some of the design features and design for brain health, with the idea of preventing or decreasing loneliness. So this village is an effort to integrate brain health principles into the design and into the community development at the very beginning, but we're also evaluating the impact at baseline and over 1 to 2 years. So from surveys and workshops with co-production, co-design between experts, but also the residents themselves, we've developed a brain health village framework. And there's 6 pillars to this framework. The first is taking a life course approach, building awareness and understanding of brain health among community members and policymakers, focusing on collective actions to promote brain health and reduce stigma. The second pillar is around stakeholder engagement and co-creation, and recognizing the community as part of a broader network. The third is incorporating equity and security values, but also social inclusion. The fourth is creating an intergenerational community, but also linking it to arts and creativity, and having arts and creativity as tools for well-being and community building. The fifth pillar is emphasizing the built and natural environment to create sustainable, accessible, and pleasant spaces. And the final pillar is about making sure that there is integration and service availability for everyone. So the residents now have been working on a co-production process, and they've identified priority areas, and they've developed an implementation plan focusing on several key areas for social connection. They've introduced a healthy food program, a social walking club. They've improved their own environment through planting, lighting, and accessibility. They've built a brain health bench for where people can get together and communicate and talk to one another. They've also built partnerships with local sports clubs, cultural organizations, and the staff and residents together have introduced brain health training and an awareness program. So if you were to meet any of the residents from this village and ask them what's going on here in Baltinglass, they would say, well, it's about brain health. The impact on health, well-being, and quality of life is going to be evaluated. We have baseline measures now on health, well-being, and on loneliness. And we'll be looking to see at 1 year and 2 years, what is the impact on these health and wellness measures, and particularly on loneliness in these residents. So coming to my concluding remarks, loneliness, I think I've demonstrated to you, is a growing global epidemic, and it certainly has significant impacts on health, particularly on mental health. If we're going to tackle loneliness, we have to take a population level approach. I believe that the built environment can be designed to enhance social interactions and mitigate loneliness and improve brain health. And I've given you some examples of that. But the social infrastructure must also be adapted to support engagement, inclusion, and participation. And projects like Ibashua and the Gaia Tower and the Brain Health Village, I think, are good examples of adapting the built environment, but also creating the social infrastructure. But very importantly, we need to promote intersectoral engagement and cooperation across many disciplines and professionals. We need to get architects, planners, healthcare professionals, researchers, and policymakers working and talking together. And very importantly, we need to generate more evidence and evaluate the impact of what we are to do. Otherwise, we're not going to be able to convince policymakers that this is the way to go at a population level to try and impact on loneliness. So a couple of takeaway messages. Loneliness is bad for your health. It can kill. Connection heals. Connection can make you feel better, but very importantly, connection can build a stronger brain. Design matters for connection and for brain health. And if we design for brain health, I believe that we can mitigate at a population level loneliness. So I believe tackling loneliness at a population level by designing for brain health is the way to go. So thank you very much, and I'm happy to take some questions.
Well, that was really interesting. I have to say, very topical too. Though I notice you haven't mentioned very much about what we might be learning after the experience of lockdown. What's your overall reaction to what we saw happen, perhaps how governments reacted, and what kind of aftermath might we expect from that particular experience for us all?
Well, I think from the lockdown and the social restrictions, we saw what happens when people become socially isolated, and this biological drive to connect. And as you probably remember, when the restrictions were taken away, there was a massive connection of people, which obviously increased the spread of the virus. And again, I think that was biologically driven. That's a brain thing. This is because social connection, it's biologically driven. So what do we learn? I mean, I think we've learned very much about how important social connection is and what happens when we restrict. And I think we have to be very careful and mindful of this, because there are dangers of not of connection to the spread of a virus, but there are also very significant dangers to social restriction. And we saw huge impacts on caregivers, but also on people living with dementia, on people with mental illness. So I think we have to try to see how we can balance and get the right balance here. And I think there's been a lot of learnings from the experience, which I hope that we will be able to take forward. But I think it will be a balanced approach. When I think of some of the very difficult times that carers, family members, spouses had with the individuals in nursing homes, talking through windows, and the pain of the care and the pain of people living with dementia, I think we have to take a more measured approach, I think, in the future. There is an element of protection and trying to prevent the spread of the virus, but also we have to think of the importance of human contact and of social connection.
Clive Bullen is asking, if you were to be advising a lonely individual, what would you recommend a lonely person to do to help themselves? Where would you start?
Well, that's a really good question. And I guess as a physician, one of the things, when I was in medical school and training as a psychiatrist, I was taught nothing about loneliness. So one of the things for me right now is actually to ask the question. I think it's very important that the question is asked, but if you are a person who has experienced loneliness themselves, also to volunteer that you do feel lonely, because it is a subjective experience, and unless you volunteer the information or unless you are asked the question, people may not know that you are lonely. So I think first of all, it's about detection, it's about being aware, you being aware that it's important to your health, that if you are lonely, that we try to mitigate that loneliness, but it's also from a clinician or physician's point of view to ask the question. I think it's in terms of if somebody is lonely, what I would try to do is identify, I guess the origins of the loneliness. Is it social loneliness? Is it emotional loneliness? Because what you're going to prescribe or how you're going to deal with the loneliness is going to vary, and the interventions may have to be very individualized in terms of what you would prescribe. So I think obviously connection is what you would prescribe for emotional loneliness or social loneliness. How you would go about that connection for an emotionally lonely person versus a socially lonely person is different. Somebody who's socially lonely, it might be easier to identify group activities that they might be able to participate in. For somebody who's emotionally lonely, because of the hypervigilance and mistrust, you may have to develop a deeper sense of rapport or relationship. It may not be easy for them. You say, I think you should go to the local arts group, or you should go, get a hobby and join this group. They will find that difficult. So you have to appreciate that difficulty. So I think it's understanding the individual, understanding the type of loneliness. Also, you've got to understand what is available to them in the community. What would they like to do? What would be helpful to them in terms of forming a connection? Um, and I think that's the most important thing, is that there is a connection formed. It can be just activity based. That activity initially may not involve a lot of talking or communication, but over time, relationships can develop through the common interest. Um,
Yes, and I suppose it also depends very much on the age and circumstances of the individual. If you're looking at a young person going out to join a team, might be appropriate, but for a 70-year-old going to play rugby, probably not the best thing for them to do. Now, you've had your first piece of fan mail from Nikki Holzhausen. Many thanks for your kind, caring, and visionary initiative. A comment that exploring and touring around the immediate environment, just as travel occurred in youth, may also be helpful and interesting to the individual and assist with brain health. I suppose where it might be where people choose to live, where they've always lived, or where they suddenly find themselves. Again, circumstances, I suppose, are quite important.
Yeah, I think what I also heard from that question was the idea of novelty and curiosity and the importance. And I think that, you know, no matter where you live, I mean, you can experience awe. You can, it's this what they call this, I suppose, slow art, or I suppose the power of looking at things in a slow way, and sort of taking in the environment, taking in nature, um, exploring the possibilities. I mean, I think curiosity and openness and novelty are really, really important for the brain. And even in an environment that you're used to and that you're familiar with, there may be novel aspects that you can explore and look to. Now, from a design point of view and a planning point of view, it's important to try and put some of those elements into what you're doing, whether it's in the built environment or in the social infrastructure, because that can encourage that curiosity and that novelty seeking, which is good for the brain. But I think, nature and awe and experiencing that, that feeling of awe when you go for that walk and you really get involved in nature, that has amazing power to change your brain. It can make your brain more plastic, but also improve your mood, create a lot of positive emotions. That's really, really good for your brain health. And you can do that on your own, but obviously you can do it with other people as well, even better.
It's interesting thinking about the environment. Oddly enough, I was in the English seaside town of Eastbourne at the weekend, which is famous for a large number of retired people. And very interesting, the number of very wide promenades by the seaside, which would allow two wheelchairs to pass by each other unobstructed. So that might be a good example of what you're saying about environment. Lisa Nason has a question here about medical schools. Has loneliness and the loneliness epidemic been added to curriculums? And how do you think medical professionals can help to have an impact on this epidemic?
I don't think we're paying enough attention to loneliness in medical school yet. Um, and I think it's still a topic that uh, people misconstrue as a social issue rather than a health issue. I think it's a social issue and a health issue. And I think I think the loneliness epidemic and COVID, I think, has helped in terms of raising awareness about the importance of loneliness and how impactful it is on health. But I think we need to get deeper into the medical school, nursing school curricula about the impact of loneliness. And it's not just a problem for older people; it's a problem for younger people. And COVID-19, we were talking about this earlier on. I mean, the impact that the restrictions had on the educational experience and the development of the brains of younger people. I think that's very, very significant. So we need to really do a better job at getting it into medical schools. I'm a psychiatrist, and I think from a psychiatry point of view, and even from a mental health point of view, I think mental health professionals don't embrace loneliness the way they should. We don't consider loneliness a mental disorder, and maybe that's correct, even though it can be quite distressing and impair function and quality of life. But it's certainly a very significant comorbid feature. And I think if you don't detect it or know about it or ask about it, and for example, you're treating somebody who has depression, but they're also very lonely, you're not going to get a proper response to depression unless you address the loneliness. So I think we need to do a better job in terms of educating the general public, but also medical students, nursing students, doctors about the importance of loneliness and why it's important to health, mental health, and why we need to detect it, diagnose it, and treat it. And I think doctors have an important job to do here. We need to embrace this as a health issue and a medical issue, as it is, in addition to be a social issue. And I think one of the problems we've siloed between professions, and I think we've got to the social scientists, the doctors, the neuroscientists, the architects, the planners, the policymakers. We all need to work together. Loneliness, is a transdisciplinary issue. We can only deal with it as I was describing, in a cross-sectoral, transdisciplinary way at the population level. That's the only solution, ultimately, to prevent this terrible disease.
Indeed. Leva Levitt is raising the interesting question of social media, which has become so prominent in recent years and was perhaps quite important in keeping people in contact with each other and possibly keeping sane during the lockdown. But her question is, what is the role of social media in the increase of loneliness? I have the feeling this has cut both ways.
Yes, it does cut both ways, and I think there is I think digital technology, social media, could be used in a very helpful way as an adjunct to manage loneliness. But I think social media can perpetuate and increase loneliness, and I think social media is probably driving a lot of anxiety in adolescents and young adults now, and is pushing people towards isolation. And I think one of the things I've learned down through my professional life is the importance of connection and face-to-face. I think digital technologies can be beneficial and helpful and supportive only as an adjunct, not as a replacement. We have to connect. And there's no substitute for being together. And again, I think COVID showed us that. And I think that's still, to my mind, is still one of the dangers or risks of hybrid working, and the fact that we haven't quite returned to people being, in the workplace all the time. The dangers of professional loneliness and loneliness increasing at home now because people don't have that workplace connection, the friendships that they would have had in the past. I think we have to keep an eye on that.
Yes, I must admit I'm very ambivalent about Zoom meetings. On the one hand, yes, you can see they're convenient. On the other hand, I always feel that the real business of the meeting takes place with the coffee beforehand and the drinks afterwards. And with Zoom, people tend to sit there glumly staring at each other. And during the meeting, you can't whisper to the person next to you, what the hell's he going on about? Which is usually quite a positive way of moving a meeting forward, but you can't do that kind of thing. One question, of course, with regard to isolation, there always have been people who've either had to face isolation as part of their work or who've been away or in very limited social circumstances for a long time. I'm thinking of those fire rangers in places like California who spend the whole summer sitting up a tower looking out for fires. Prisoners, of course, would spring to mind. And what about the prospect of space travel? If you're going to Mars with the same three people, do you think people will be sane by the time they get there?
So that's a really good question, and I guess the best example I can give you is these Antarctic explorers, because there's been some studies done with regard to isolation and loneliness in these individuals, because they have been away, in these stations for 10, 12 months at a time, and what has been shown was actually the brain can shrink in these individuals, probably related to the isolation and loneliness, and some of the what's called BDNF, which is a brain like brain fertilizer, brain hormone protein. Those levels go down. So there are impacts on brain and brain functioning from long periods of isolation and loneliness. And as I said in the talk, that we know that over a lifetime, people who are lonely and who are isolated and not socially engaged, there is an increased risk of developing dementia. And a lot of it is believed to be due to diminished reserve. So when you have a lot of social connection, stimulation, and novelty, you're building reserve in the brain. You're making the brain pathways more efficient. So if you're going to be isolated in the Antarctic for 10 months, you're not getting that level of stimulation. And likewise, during COVID-19, again, I think about those children who are not getting that social development and stimulation at school for that period of time. So that's a loss. That's a loss to development and plasticity. So, but that those studies have been done in the Antarctic and show that loneliness and isolation does impact on the brain.
Now, I've got a very nice one to finish up with here from Bernard Horning. There is a village in the middle of London in Chelsea, and this is the Royal Hospital, home to the famous Chelsea pensioners you might have come across. And he thinks this is an excellent example of how your ideas have worked so well throughout the centuries. You have these old soldiers who've been there for the last 400 years or so, and very high profile. I have visited it, very interesting place. And Bernard is asking, have you visited the Royal Hospital? And if not, would you wish to visit?
I haven't, and I would love to. I would love to, because I mean, a lot of these ideas are coming from history. I mean, and I think that, remember, loneliness has become an epidemic. Because we've become more individualistic. We're living alone. In the old days, people didn't live alone; they lived together. And I think that we can learn a lot from history. So I would love to visit and learn. Likewise, I mean, the studies in what they're doing in Japan is based on going back to between 1600 and 1800, where they had these more communal type living situations. People, working together, working for one another, sustaining one another. And this is probably the way we have to go if we want to tackle loneliness.
Yes, indeed. Now, you mentioned the phrase neuroarchitecture. If the neuro topic interests people, within the Lord Mayor's lectures, we've actually had several webinars on topics related to neuro well-being. If you are interested, go on to knowledgemiles.net and just search under neuro, and you'll find a number of very interesting webinars will come up. Now, I'm afraid this is all the time we have for questions, so it's worth mentioning that, as I say, we do have other lectures in this series. You can see what's coming up in the next week or so. Ethical digital technology, interesting, both ethics and technology are widely covered in the Lord Mayor series. 1st of October, Mission Impossible, Restoring Public Trust in the Police Response to Rape. And in October, How the Old Bailey, yes, well, of course, again, Brian, this is another one you ought to visit, How the Old Bailey became the most famous court in the world. And I think that would be a very interesting topic as well. In fact, at the end of our series, 6th of November, author and broadcaster Laura Lewington will be asking whether AI and doctor data could be the future of health. And I believe the brain is going to crop up there as well. So I think between neuro, health, ethics, digital and technology and the brain, we're doing quite well. So thanks to all of you for the audience. Thanks indeed for those questions. And especially thank you to Professor Brian Lawler from Trinity College Dublin. This lecture, all of our lectures are recorded and posted on the Gresham Society website and on our YouTube channel, in case you'd like to revisit anything. And we hope to see you all again soon for another lecture in the Knowledge Miles series. And don't forget the Lord Mayor's theme for the year, which is Connect to Prosper. Thank you and goodbye, and thank you again to Brian.
Thanks, Tim.